Hello, my name is Brandon. I'll be your nurse for the evening. I'll wash my hands real quick. Alright, can you tell me your name and date of birth?
Catherine Samuelson, 9/20/96.
Okay, what's today's date?
The 29th.
Okay, and where are you?
Your apartment.
Okay, why are you here?
For the head to toe assessment.
Okay, and with that assessment, we can tell that the patient is oriented ×3, her speech is normal, and she is able to comprehend my speech. Alright, and we're going to go ahead and start with the scalp. So, I'm going to feel your scalp and your hair. No masses or lesions are found. The hair is clean and dry. Alright, we're going to go ahead and look at the eyebrows and eyelashes as well. They're even bilaterally with no hair loss or excessive hair growth. Excuse me. We're going to check your conjunctiva. Alright, look up. Good. Look down. Alright, good. Conjunctiva is pink and moist. And we're going to go ahead and check the pupils for their reaction. Alright, look at the back wall for me. And real quick. Alright, good. Keep looking at that back wall for me. Alright, look at my finger. Alright, good. And with that assessment, we can tell that the pupils are equal, round, reactive to light, and accommodation. And we're going to go ahead and test the ears real quick for any masses or lesions. And those are normal. We're also going to look at the angle from the eyes. Should be in a 10-degree window. And I want you to close your eyes and tell me when you can hear my fingers.
No.
Okay?
No.
Okay, and with that, we can just quick assessment on hearing. Now I want you to look straight forward for me. I'm going to test your 6 cardinal fields of gaze. Alright, follow my finger with your eyes and don't move your head. Try not to move your head for me. Alright, good. There was no shaking of the eye while we were doing that. And we're going to go ahead and move to the nose for patency. Alright, so I'm going to occlude one of your nostrils and I want you to breathe in. Okay, and again. Alright, both nostrils have clear airflow through them. And we're going to go ahead and look at the mouth. Open your mouth for me. Okay, stick your tongue out, up, to the left, to the right. Alright, and we can see that all the teeth are intact and the oral cavity is pink and moist. Alright, we're going to go ahead and check for the lymph nodes real quick. Alright, and we're going to be careful not to use spider fingers while we do this. Alright, shrug your shoulders for me. Alright, and no lymph nodes seem to be enlarged. Alright, and we're going to go ahead and palpate your temporal pulse. Alright, and that is equal bilaterally. I'm going to check your carotid pulse. Alright. Alright, and the carotid pulses are also equal bilaterally. Alright, Katie, I'm going to have you look at that wall real quick. I'm going to check for jugular vein distension. We're going to hold this pen light about 45 to 30 degrees. Alright, look this way for me. And a positive sign would, you would see a jugular vein distension. And we did not. Alright, Katie, we're going to go ahead and move on to your chest. And we're going to take a look. The AP to L diameter or ratio is 2 to 1, which is normal. And we're going to go palpate your chest for any masses or tenderness. You let me know. Alright, and we're going to go ahead and feel the costal angle and the rib angle. The rib angle is 45 and the costal angle is 90. Alright, and with that, we're going to start with the stethoscope and I'm going to listen for a bruit in the carotid arteries. Alright, hold your breath for me. Alright, hold your breath. Alright, no bruit detected. And now we're going to go ahead and check the heart sounds real quick for S1 and S2 sounds. I'm going to start with the diaphragm. Alright, now we're going to switch to the bell of the stethoscope to listen for any murmurs. All right, no murmurs were detected. And now we're going to go ahead and we're going to check the apical pulse, and we're going to check her respiratory rate at the same time. All right. You're just going to relax there for a couple minutes, okay? All right, and with that, she had a apical heart rate of 64 and respiratory rate of 18. All right, now we're going to go ahead and assess your abdomen. Can you slide down a little bit for me?
All the way.
Just a little more. Let me fix those pillows for you. All right, go ahead. And just pull your shirt up just to where I can see your abdomen. All right, we're going to start with assessing the abdomen. We cannot see any obvious abnormalities, I'm sorry. And we're going to start with auscultating, listening for bowel sounds in all 4 quadrants. All right. All right, and all sounds are active in all 4 quadrants. Now we're going to check for the abdominal aorta, see if we can hear any bruits, and we're also going to check the renal arteries and iliac arteries with the bell. All right. All right, and no bruise detected in any of the arteries. All right, and now we're going to start the physical assessment part with some palpation. And we're going to start with light palpation. Do you have any tenderness anywhere before I start?
No.
Okay, and you let me know if anywhere hurts, okay?
Okay.
All right, and now we're going to go to deep palpation. All right, no tenderness at all during that?
No.
Okay. All right, and no masses or abnormalities found there. All right, you can lower your shirt for me. All right, I'm going to have you sit up for me. We're going to start with your respiratory now. You just sit on the side of the bed for me. All right, now we're going to listen to respiratory sounds across the anterior chest. And I want you to just breathe normally for me, okay? All right, no wheezing or crackles heard. And since we're sitting up, I'm gonna go ahead and have you do some facial movements for me. Okay, can you lift your eyebrows up? All right, can you close your eyes for me? And I want you to try and, don't let me open them. Close them for me. All right, good. And I want you to puff out your cheeks. All right, now blow out a candle. All right, bare your teeth. All right, now smile. All right, and all the movements were equal bilaterally. And we're gonna go ahead and listen to the back now for respiratory sounds. I'm gonna move your hair. There we go. Just breathe normally for me. You can sit up. Can we scoot up to the bed a little more so I can reach better? Thank you. All right, good. No wheezes or crackles heard. Now we're going to do the lateral sides. I'm going to start over here. All right, move your arms a little bit for me. Okay. All right. All right. All right. Okay. All right, one more. All right, no wheezes or crackles heard on the lateral side either. All right, and now I'm gonna have you squeeze my hands. All right, and arm strength is equal bilaterally. And I want to go ahead and see your hands again. All right, now we're gonna inspect the fingernails. No clubbing or obvious abnormalities there either. And we're gonna check the capillary refill of each fingernail. All right, and they're all under 3 seconds, which is good. And we're going to also check the skin turgor, which as we can see is good there. And we can also see the skin on the arms and the face is appropriate for race. And we're going to check the arms for any edema or masses. All right, I'm going to check the skin turgor here real quick. All right, skin turgor is normal. Check for any masses or edema again. All right, and we're going to go ahead and do some range of motion with our arms while we got her. Right here. I want you to hold your arms out. All right, we're going to start with your fingers. I want you to go down, up, to the side, in. All right, now we're going to do your wrists down, up, out, in. All right, and now we're going to do your elbows. Hold them out, in, back out. All right, good. And your shoulders, I want you to do what I did. All right, you're going to go up, all right, down, one behind your back, now the other, one behind your head, and the other. All right. and full range of motion in the fingers, wrists, elbows, and shoulders of the patient on both sides bilaterally. And now we're going to go ahead and I'm going to have you lay down for me. Sorry. Alright, and we're going to start with the bottom. And usually, if in a real clinical scenario, we would remove this nail polish so we would be able to better assess the patient. But for assessment, we're just going to go ahead and check the capillary refill, which would, normal indication would still be under 3 seconds. We're going to check the skin turgor. And when we do that, we're also checking to see if there's any clubbing down here on the toes as well. Alright, and we're going to check the dorsalis pedis pulses. Alright, and those are equal bilaterally. Now we're going to check the anterior or posterior tibial pulses. Sorry. Alright, and those are also equal bilaterally. The skin color is also appropriate for race. I'm going to scoot this up a little bit, Katie. Alright, and now we're going to check the legs for any edema or masses as well. Alright, any tenderness anywhere, Katie?
No.
Okay. Alright, no edema or masses. Notice. Now we're going to check for a home sign while we're here. Alright, I'm going to lift your leg up and you just tell me if you feel any pain, okay? We're going to push back the foot right there. We're going to do that on both legs. Alright, again, tell me if you have any pain. Alright, no pain?
No.
Alright. And a positive Holman sign is usually because of a DVT, and so after that I would not ambulate my patient. It feels positive. And now we're going to check for sensation on the patient. And this is going to be our soft, dull, and sharp. Alright, Katie, I'm going to have you close your eyes in a second, but this is going to be the sharp, this is the dull, and this is soft. Okay? And when I do it, I want you to tell me which one it is, okay?
Okay.
Alright, close your eyes.
Okay. Sharp. Sharp. Dull. Dull. Sharp. Soft. Soft.
Alright, and patient has normal sensation in her feet. Alright, I'm going to go ahead and put these back down for you real quick, okay?
Okay.
Alright, I'm going to go ahead and have you stand up for me. And now we're going to move on to some range of motion for the legs. We're going to start with the hips. And we're just going to have you keep your legs straight. I want you to kick forward. Now with the other leg. Alright, and out. Now with the other leg. Alright, I want you to scoot up some. Now I want you to kick back. Alright, with the other leg. Alright, and you can scoot back again. I want you to bring your knee up to your chest. And your other one. Alright, and scoot up a little bit, I'm sorry. Not a whole lot of space here. I want you to just kick your leg back, like that, good, and the other one, good. Alright, and now I want you to, if you can, standing up, I want you to put your heel, run it down your shin. Alright, and let's make sure we're getting all this, and the other leg as well. Alright, good. I'm going to have you sit down. Don't lay down, just sit down for now. Now we're going to do the ankles. I want you to point your toes down. Alright, now up, now out, in, and can you do a circle for me? Alright, good. And so that shows that we have full range of motion in the ankles, knees, and hips that are equal bilaterally. And now I'm going to have you stand one more time. Alright, I want you to stand on one leg. Alright, and stand on the other leg. Alright, and that's also a good range of motion exercise as well. And now we're going to test for the Hamburg sign, and I'm going to have the patient close your eyes. And you're just going to put your feet together and your arms to your side. And we're going to look for any swaying. If the patient would sway, that would be a positive sign. Okay, you can open your eyes. And that will conclude this head-to-toe assessment.